So Matilda, do you like going to the doctors?
No.
Do you think that horses like to go to the doctors?
Hello. Are we meeting a horse doctor today?
We're actually meeting an equine veterinarian. One of the toughest, scariest, a little bit gross, but very cool jobs out there.
We're basically meeting a superhero.
We're meeting Dr. Christi Garfinkel.
Yeah, let's go. Come on. Hi, Dr. Garfinkel.
How are you, Matilda?
I'm good. How are you?
Good.
Thanks for having us.
You're very welcome. It's my pleasure. I am an equine veterinarian here in San Diego County. In my late teens or early 20s, I had a very, very good dream about horses. Within 6 months of that dream, I had bought my own horse. One of the horses in our stable got very sick with colic, and I didn't know what that meant, and I was very concerned and wanted to know how to help it. From that point on, I decided to focus on horses.
You can actually say that you're living the actual dream.
I can say
That's
that.
amazing.
I am.
That's
I am.
so cool.
Hi, welcome to my office.
This is a big car.
It is a big car. Big truck allows me to get on all the dirt roads and mountain roads and go all the places that the horses live. Okay. So this drawer has the medications that I might need to leave for people. Many medications for horses that come in a paste form. So that we can just stick it in their mouth and squish it in there, because many horses are difficult to give pills to. They don't like to take pills, so it's much easier to give it in a paste. So we have antibiotics or test kits to check for infection. So if you're going to be doing an examination on a horse to see if she was pregnant, you would need to wear these very long gloves, because obviously you don't want to get yourself contaminated.
Hello. Karin, hello. What was it with horses that made you just say, that's what I'm doing? What's the thing?
I think that they're just amazing animals. I think that it's amazing that they can allow us to work with them. They sure don't have to, as big as they are. If they decided they didn't want to do something, they just leave and we would have little to say about it. But the bottom line is the relationship with the horses. I think that it's a really wonderful thing. I like how they connect with people. I like that they interact with you if you take the time to listen to what their ears say and their eyes say and their body posture says. You can really get a lot and really understand their communication. And they're so powerful, and yet they choose to be with us. And I really, really like that. My favorite part is obviously the horses. I love them. Every patient that I see has its own personality.
But how do you deal with like animals that are in pain, or horses that are angry or sad?
Well, I try and get them as comfortable as I can, as quickly as I can. So I get there and I assess the situation. And if they're very, very painful, I'll give them some medication right away that will help to make them less painful. And that often calms everything down. And then it allows me to figure out, what do I need to do moving forward?
Dr. Christi, what are you doing today?
We are giving Dream her semi-annual checkup, and she's getting her vaccinations to make sure she stays healthy. We're going to pull some blood on her just to check her health inside. She is a very healthy 31-year-old girl, so that she can have many more years going to her pastures in Colorado. She's a very good girl. It's a very physical job. So you need to be strong. The hours are very long. You have to be very dedicated to your schooling and get good grades. I think anybody can do it if it's in their heart. If that's what you really, really want to do, then I think that there's nothing that stops you. You have to be able to interact both with the horses and other animals. You need to be comfortable being dirty, because as we talked about, the gross factor is sometimes there. But there's also the awe factor when a new baby comes, and you get to see that baby just when it stands up for the very, very first time. That's so exciting. The worst part of my job would have to be saying goodbye when they're very loved. Been there and done that. Sometimes we just know that that's the thing that needs to happen, and it helps to realize that you're making that horse not suffer anymore. And it makes me very sad. You can see It's a tough thing to talk about, but it's necessary. That's the worst part. Lakota is about to get a dental, which means we're going to file off the sharp points in her mouth and make sure that she stays comfortable when she's working in a bridle. And I use power equipment for that. So in order for her to be happy about it and for our safety, they get a little bit of a sedation. So I'm going to listen to her heart and make sure she sounds healthy. So this part's a little bit of a messy job, but it's also very satisfying. Oh yeah, see all that cookie coming out of her mouth there. And now we're going to put on, this is called a speculum, and this helps to hold their mouth open. Open. Not there. You see these very sharp points here, where my fingertip is?
Yeah.
Those can be very, very sharp and can cut the inside of their gums and their cheeks. So we're just going to file these little points off so that they are not so painful. It's very loud. So that didn't take very long at all. We don't want to dwell on it. We don't want to do more than we have to. We just want to keep them happy and comfortable so that they can keep having fun with us for as many years as possible.
It's truly sad to leave this place. I've had such an amazing time and learned so much.
Yeah, Dr. Christi is amazing and she truly has superpowers, and that superpower is loving horses.
Yeah. And by treating the horses with love, she makes the horses feel comfortable in a very uncomfortable situation.
Yeah. So all of you out there who wants to be equine veterinarians, go for it.
Yes, and follow your dreams. That's what I learned today.
Yeah,
Sure did. Let's go follow our dreams, Karin.
Let's go.